Hi friends, my name is Miranda and I am here to talk about my organizational analysis over Community Hospital in Anderson, Indiana. Community Hospital is a hospital located in Madison County that holds a place near and dear to my heart. I was born at Community Hospital. My daughter was born at Community Hospital, and I started working there my junior year of high school as a co-op student, and I worked at Community until I moved to Oklahoma in 2013. I was able to go to school and start my journey for college while at the hospital with reimbursement tuition help from them. I worked in many different areas of the hospital: finance, patient accounts, medical records, coding. I did a lot of volunteer outreach for the community, so I was able to see different dynamics of the community and what it takes to have a successful hospital in a community the size of Anderson. The hospital has faced many challenges and continues to face challenges just because of the current insurance reimbursement situation, an aging population, a pretty bad drug problem that exists in Madison County, and they've continued to find ways to excel and put programs into place to make the hospital viable and successful, and they've just had to get really creative in a lot of ways, and that's made them just a key player in the medical community in Anderson and Madison County. The staff consists of people all the way from grounds workers, cafeteria workers, transportation of patients from floor to floor workers, physicians, surgeons, x-ray technologists, surgery workers, laundry workers, to the financial side with accountants and payroll and human resources. The list goes on of the opportunities that are available at the hospital. The hospital does run off of a style of leadership as a hierarchy. There is a president, a vice president, down to, department leaders that all report to the president. And all of those positions are filled by a normal application process and interview process. The strategy of the hospital has always been and remains pretty simple. It's to be the market leader in the county. There is another hospital, St. John's, that was opened before Community and does have a large patient volume, but Community has over the years risen through the ranks and dominated and captured a lot of the patients that St. John's used to have, especially in a big reimbursement area with the obstetrics and delivery of babies, because they did become a baby-friendly hospital, and that's a very honorable designation to have. The mission and values. The mission statement is being deeply committed to the communities that Community serves and enhance the health and well-being of the community. They strive to do this by many different ways. There's lots of community outreach, lots of financial help for people that can't afford to bring their children in or afford their prescriptions. There's financial assistance, prescription help, insurance help to get people linked up with an insurance that they can afford or that's free, like Medicaid or Medicare for the older population. The values stand for PRIDE, which are patients first, R for relationships, I for integrity, I for innovation, D for dedication, and E for excellence. And these are all things that are taught from the very first day in orientation. The pride that they take for each patient, the diligence that is shown to each family, the care that they just want to provide exceptional care to each patient. Whether you are delivering a food tray or you're performing a life-saving surgery, these core values are instilled in each and every employee from the time that you sign the papers and become a part of the community hospital family. As far as skills that it takes for the hospital to run efficiently, it's all kinds of skills, but one of the main skills that they try to instill in people is the skill of just being caring, and that the families are in a lot of distress sometimes. It's not always a happy situation like a birth. A lot of people are, near the end of their life tragically, or just because of old age, but they want each family and each patient to be treated exceptionally well. The hospital has definitely faced some challenges, and one of those is there's a large drug problem in the community, and so there was a spread of disease and just lots of overdoses, and so they had started a needle trade program where people could come in and trade in their dirty needles for clean needles, and they did see a decrease in the number of HIV infections related to that. They've also started a co-op program with the local community college because of a nursing shortage that is nationwide, and so they're able to let nursing students do their clinicals at the hospital, and then have hiring and sign-on bonuses for those nurses once they graduated. And it just really encouraged those students to see the culture at community hospital and to want to be a part of that when they graduated. The organization continues to face challenges with reimbursement because of government taking away reimbursement for rural hospitals, or just paying them a lower rate like they do for the hospitals in big cities, and it just makes it harder for them to operate. The hospital did get creative on some budgeting ideas, and they've been able to keep their head above water, and also to still give employees competitive wages to keep the staff happy. So all in all, the hospital has done a great job, and their future looks bright. And if you're ever in Indiana and you need medical care, I would highly suggest that you visit Community Hospital Anderson. Thank you.